So the first big governance flaw in New Brunswick is the way we plan for human resources. If you were going to plan for how many you would need of given profession, say you were figuring out how many psychologists you would need in a given year and how many you'd have to train, what you would probably do is you would sit down and say, here's how many people we think are going to need the service 10 years from now based on demographic trends, based on current demand, but also changes in who's using the service. You would figure out how many people need it, how quickly you need to make sure they have the service before new problems become introduced. For example, if we don't get a senior home care in a certain amount of time, are they likely to wind up presenting at the hospital in crisis? If we don't get a young person assessed, how long before they're simply not going to learn to read as well? So you would take a look at how quickly we have to deliver the service, how many people need it, and your number would be simply how many people then do we need in that profession? And you would then probably turn to a university or college and say, how much do you need in this budget to make sure that 10 years from now you've graduated this many people? That would be how most people would think it would be done. None of that is how it's done in New Brunswick. In fact, years ago, government began restricting enrollment because it was a way of controlling costs. Let me give you an example. One reason we have a billing number system and we began restricting medical school enrollments in the 90s is people figured out, wait a minute, if there are fewer doctors and nurses providing health care, we can then control costs and make them more predictable. The way I explain it to people sometimes this way, imagine we throw an event, we have an open bar. And we like to provide everybody drinks without costs and people line up and do it. If somebody came to us and said, this budget's out of control, what are we going to do? Well, we could charge for drinks, but we don't want to do that. We're talking about healthcare, this metaphor. We don't want to start limiting how much people can have. The one way we could control costs is if there's 6 bartenders serving drinks, cut it down to 3. After all, that way people will get their drinks slower. We control costs. Now, the lines will grow, but maybe some people will decide they don't really need it. It will discourage use. It will do a bunch of other things, and we can control costs. That's basically what we did in healthcare in the mid-90s. It continues to be under Medicare, of course. Services don't have user fees. You don't want to cap them. If people are sick, they're sick. But you can make them wait longer. That works for a while, but at some point, if you don't have a real standard of, but how long before things get worse, you wind up with a problem. So unfortunately, what we did through billing numbers, driving doctors away, restricting enrollments, making sure universities didn't train too many doctors and nurses, is we provided numbers of professions based on the demand of the day and how much we were hoping to spend, not on what people would actually need. Now imagine the same thing being done over and over. Psychologists, social workers, teachers, all of these things essentially are ways of controlling costs of how much we spend training people, but they don't necessarily deal with the problem. The line keeps growing. And if you said, well, what if the line eventually grows so long that other bad things start to happen? Well, the model wasn't really built for that, but we're still using it. In fact, when we contacted the Department of Post-Secondary Education, Training and Labor and said, look, how many spaces, say, of psychologists? Because we have a huge shortage now in psychologists. We have, I think, 27 positions of school psychologists, only 7 are filled. We have wait lists that are unacceptably long for young people in crisis, so they're showing up at emergency rooms, which not only aren't giving them the care they need, the emergency rooms are also overrun. Well, what we got back is we don't even think in terms of seats or numbers of psychologists. We provide block funding to universities and they do what they're going to do. Well, a lot of years, the number of graduates from clinical psychology at University of New Brunswick or the University of Moncton are around 2 a year. If you've got a shortage of 60 to 80 psychologists, you're not going to get there with 2 a year. Seems pretty obvious. So we don't have any department at the center of government that actually models demand. For instance, how many spaces are we going to need in long-term care when the Gen Xers are older? How many, with the explosion, say, of autism spectrum disorder diagnoses, how many children are going to need EduPsych assessments in grade 1 5 years from now? How many nurses are we going to need in order to make sure there are enough long-term care beds? If you ask government those questions, we don't know. And in fact, we don't fund human resources in a way that sets any objective standard. So what ultimately winds up happening is we just push problems further and further into the future, but at some point things start to break. After all, after a while, your emergency room simply can't deal with can't be the catch-all for every kind of primary care service we didn't have enough doctors and nurses to provide. And things start to get more expensive. So if you don't train enough nurses for tomorrow, it doesn't necessarily mean you'll save money. If you haven't come up with any objective standard as to how to avoid problems, what you'll really wind up doing is, for example, overpaying greatly for a scarce resource by paying travel nurses 3 or 4 times what would have cost to have nurses trained in the first place. So we're not only breaking our social model, we're breaking our fiscal model. So one of the first government flaws we've suggested get fixed is we need to budget based on actual future demand and set actual standards for how quickly we need to serve things, and base human resources on need, not on what we wish were true. And that's the first governance flaw we need to fix in New Brunswick.